Hi, I'm Shauna K. Lester, founder of Memorable Essay. I help people who are applying to college, to graduate school, as well as to medical residency and medical fellowship to stand out and to get into their dream schools and programs. To me, I love to work with individuals who are really about having the impact that they want to have in the world, as well as creating a life and a legacy that they're really proud of when they get old, right? So today, I'm really happy, Asherah, to be joined by Dr. Corbin, Asherah Corbin, and she's going to share with us about her journey to medical fellowship. She's an anesthetist, she says, or anesthesiologist, depending on where she practices, and definitely has a big heart for, her patients, and depending on how much she says, you'll learn what she sees herself doing in the future, but just really, someone who I have a lot of admiration for. And I'm glad that she's going to be able to come and share with us just a little bit about her story, as well as her experience with Memorable Essay. So thank you so much for being here.
Thank you for having me. Yes, I'm glad to be here.
Okay, thank you. All right, so we can start with you telling us a little bit about who are you, who's Dr. Corbin, or who's Asherah?
Okay, well, I am a young anesthetist. I recently graduated from University of West Indies Mona campus. I actually did both my undergraduate, so my medical degree, as well as my residency degree there. And so therefore I've lived and worked in Jamaica for a very long time. So Jamaica is like my second home. Since finishing, you're at the point in your life where you're really trying to figure out what is next for you. And so I had a really good think and contemplation about what I really enjoyed during residency. And therefore, what would I like to see my life looking like 5-10 years on the road? And therefore, what kind of fellowship would best allow me to have the life I want, as well as enjoy my work day to day and really get a sense of fulfillment of what I can offer my patients. So that's me on the medical side. On the other side, I'm a girl who likes weekends, naps, and spending time with my friends and family. So I guess that's just me in a nutshell.
All right. I've Googled Asherah. I'm not telling you to do it, but if you do that, you'll actually see that she's also, would you call yourself a former beauty?
Former beauty blogger. I think I'm going to try to get back into beauty blogging. Unfortunately, my blogging days were numbered during residency. I just simply didn't have the time. But that is definitely another side of me that I like to enjoy. I like to pretty up, playing makeup, playing hair. Right. That's my kind of thing. So it's an outlet from the rigorous day-to-day, life that is medicine. So, yeah.
Sure. All right. And you said that, you spent a lot of time in Jamaica, so it's like a second home, but where's the first home?
So my first home is Barbados.
Okay.
Born here. I lived here continuously up until university. And now I am back for a short while until I go ahead and start my fellowship program later this year. So it's nice to be back though.
All right. So could you tell me a little bit about, well, before we actually get into what you applied for, which is the question I have, but what is it about, for those of us who aren't familiar, what is it about anesthesiology that pulled you to it as a specialty?
Well, for most of us, at least in our program at University of the West Indies, your exposure experience in anesthesia is quite short. It's only about 4 weeks. And for me, that time was really discovering what it is about. Because normally when people think of medicine, you think of the usual, you want to be a cardiologist or a surgeon or something like that. And my time in anesthesiology really demonstrated the breadth of knowledge, the depth of knowledge that a good anesthetist requires, and what a significant impact having that knowledge and then utilizing that knowledge really has on a patient. You work in tandem with surgeons, your day-to-day practice. So you're able to create conditions where patients thankfully are able to have surgery with minimal pain and not being aware of what's going on around them, which a lot of people appreciate. So yay us. And
I've had that experience. So yeah, you guys.
Yes, patients are often terrified about the entire process surrounding surgery. So for us, having the knowledge, and this is detailed knowledge of all organ systems, the interplay between the systems, how drugs affect the system, how we can then use that information to create states of unconsciousness, and in order to facilitate what the surgeon has to do, and as well bring the patient through the entire process safely. And that's a big thing for us. Safety, and how do we reduce risks? So that's a big thing for anesthesia. And I think for us as medical students, oftentimes you thought of the anesthetist as the person who, they just put the patient to sleep, and then they just sit there and record numbers on a screen. That looks so simple, but during my time in anesthesia, it was like, okay, there is a significant skill set and knowledge base as required. And I was really intrigued by that. I will say though, I still was dead set on being an obstetrician, because that was my mantra. But actually physically having an opportunity to physically be in the specialty and get my hands dirty, so to speak, and be part of that process really pulled me into the specialty. And as such, I just never left. I started in anesthesia, and it was supposed to be a stopgap until I could go to obstetrics. And then I never left, So it's been a wonderful, how many years? 7 years in anesthesia.
Okay.
It's been a good time, and I love what I do most days, as is with most people. But yes.
Yeah. Okay, cool. Yeah. And I mean, it really is important. I've never thought of it that a medical student would think to themselves that it's secondary to maybe something like surgery. But I remember doing surgery myself, and actually the person I had the most questions for was the anesthetist, because my big concern was, will I wake up? Are you sure? Will I... I was really concerned. Like, will I actually, I think I was 14 at the time. It was terrifying. Like, will I actually wake up? It's
one of the most common questions. You sure you're gonna wake me up? I'm gonna get up. Okay. Like, don't worry about it. We got you, right?
I did the math correctly.
Yes, we got you. Yes.
All right. And so could you tell us a little bit now, like, having realized that you like the specialty and that you want further training, when you're looking around for this further training, what did you decide to apply for and why?
So I decided on applying for the Perioperative Medicine Fellowship at University College London Hospital. And as the name would imply, is in London, United Kingdom. Throughout my time in anesthesia, I noticed that increasingly, generally speaking, our population is getting older. And with the advances in medicine, we're able to do more for a greater subset of people now than we did, say, 20, 30 years ago. So we're offering a greater number of surgeries, with a greater degree of complexity to patients who are older and patients who are sicker. So as such, your skills as an anesthetist or an anesthesiologist has to keep up with the demand and with the patients that you are caring for, right? Okay. So every anesthetist really and truly does practice perioperative medicine to an extent, and is really a new and emerging subspecialty within the realm of anesthesia and intensive care. But it really just highlights the need for a dedicated team-based or multidisciplinary team approach to identifying those patients who are at highest risk during the perioperative period, and seeing how can you optimize them or improve their likelihood of, going through the entire process with the least amount of morbidity possible. Right. How do you achieve that prior to surgery? And how do you then follow through with that plan during the surgery and even after, and extending the care for them beyond the normal period that an anesthetist normally would interact with a patient? Because often, especially for well patients, I might meet you the day before the surgery, you know, see you the day of, and I say goodbye in the recovery room and you never see me again. Okay. However, there are a lot of patients who require a greater, what's the phrase I could use? A greater degree of monitoring post-operatively.
Okay.
And in following them over a longer period of time, you're able to detect potential problems that can happen earlier and therefore prevent them from happening, or at least decreasing their impact if they do happen.
Right.
And because I recognize that there's an increased need for an approach such like this, that's what really got me interested in this specialty itself. And then I started, you know, researching, seeing what a program actually looks like. What does it entail? What would I actually gain from the program? Is it something tangible? Is it something I'm going to be able to, in turn, use in my day-to-day practice? And UCLH did have a program that they had started a few years ago, but they're probably one of the hospitals most at the forefront of this emerging specialty on that side of the pond. So to speak. So I really was interested. Okay, they have this program, it's established. You know, let me see if this could work for me, if it's something that, you know, would really get me to the point where I have gained this knowledge and experience and I can now in turn utilize it to help my patients. So based on that, I did some little forays. I looked around, I emailed the head of the program at UCLH just to hear, you know, what did he think, what the day-to-day of the program looked like. And from there, I then decided, okay, you know what, I'm going to go ahead and apply for this fellowship. And that's where Memorable Essay came in, because I hadn't applied for anything in like forever. And, you know, the entire process just seemed really overwhelming and with so many different components. And I just knew that in order for me to increase my chances or get the best possible chance of success, that I needed some help.
Right.
And therefore, I looked around. I actually have some colleagues who utilized Memorable Essay in the past, and who have been successful in doing so. Most of them are in the States currently. And it was just on Facebook, and I saw a video just like this one pop up on my timeline. And I was just like, oh, wait, I know him. And he was talking about, you know, a colleague of mine from medical school, he was in my class, saying, you know, his journey through USMLEs in his case. And the whole process of matching and how this service was able to help him. And I said, well, you know, I need help as well. I have one clue what I'm doing. So let me just, you know, hit her up, go on her side. Like, okay, everything seems so well laid out. Like there's a plan and there's a process, and I love plans. I love organization. So that one got me. I was just like, okay, there's like a box I can tick. Okay, can do this, tick.
Yes.
Next step, tick. Okay. And that's where I then said, okay, let me just really do this, invest in myself. Right. Because really and truly, this process is about investing in yourself, investing in the idea that there is something out there that you want that can help you, and in turn you can use it to help others. How do I get into that program? So that was my stepping stone, you know, into the whole process of applying for a fellowship and seeing where that took me. And
something that you said, we're going to talk a little bit more about the Memorable Essay experience, but something that you said about perioperative medicine is sort of seeing that it's something to come, something to be even more important in the future. So I kind of like that whole forward-looking lean of it, you know, like, I guess, where do you see yourself in the field in the future? However much of that you're comfortable sharing with us, where do you see yourself in this thing?
I think there are two paths in which I could utilize the knowledge I could gain from a fellowship program such as this one.
Right.
And in perioperative medicine in particular. One being because in the hospital setting, that's where we tend to see the older, sicker patients who come for complex surgeries, you know. So what better place where you can make an impact with that kind of knowledge? So that is definitely something that I would like to see myself doing in 5-10 years, you know, work in a department where I could be part of an actual perioperative medicine team, which doesn't really exist as it is modeled at UCLH. So if I could have a similar setup in the Caribbean where we can really focus on, you know, these elderly patients, especially in places like Barbados and Jamaica, even where, you know, having patients who are 97 years old and 92 years old is actually not that uncommon. So how best can I serve them? Because grandma, you know, she done lived her life. She's still been healthy. You know, she's someone who's still active and still, you know, she has a family that she still interacts with, and she come for surgery. And we don't want it to be like, well, you know, we have this elderly patient and so granny's sick and that's the end of it. You know, how best can we preserve preserve is not the best word, but how best can we ensure that grandma gets a good quality of living even after surgery.
Right.
So to be able to utilize that knowledge to best serve those type of patients is definitely what I would like to do. And also even in the sphere of private practice, there are different aspects of perioperative medicine and principles that you can still utilize in that setting. Just how do I optimize my patient in the best way? Especially because in private practice, you don't necessarily have the extensive tertiary level support like a hospital. So if I do a patient, I don't want it to be that the patient then deteriorates and I now have to look for a hospital for them to be admitted to. If I can have this knowledge that I can then utilize to say, okay, these are the issues that you have prior to surgery. Let's see how we can get you in the best shape possible. So you can have your surgery and, you know, within 2 days, you're back home and you're back to your usual activities, and you know, it doesn't impair your ability to earn a living. Right. Kind of so I can definitely see how I would be able to utilize it personally in both of those settings. So that's definitely why I would like to be involved in an area of anesthesia and intensive care. Such as that one.
Okay. Yeah, it makes perfect sense. Right. I never thought about it, but yeah, you're right. There are a whole lot of very elderly people in the Caribbean, 100, 102.
Yep. It's not unusual. Yep. Right. You know, so you wouldn't want that, you know, grandma has broken her hip and that's like, oh my gosh, you know, it's practically a death sentence simply because she's older. You know, how best can we take care of grandma? And I mean, we do that well already, but there's always ways to improve and reduce inefficiencies within the system, which is the whole point of utilizing a multidisciplinary team model. So if you can learn it and implement it, that's the aim.
Okay. And so you would be the person who you have this knowledge of anesthesia and you're also just coordinating the whole thing. For those of us watching who aren't doctors, you're also you're coordinating the team, making sure that everything works together.
Yes, definitely.
Okay. All right. Perfect. All right. So we can talk a little bit more now about your memorable essay experience. I always ask if you can just share honestly how you found it, and basically what would you say to anyone who's considering working with me, whether they're looking at a fellowship or a residency opportunity, you know, med school, anything in that vein?
Yes. So my experience overall with memorable essay was very enjoyable and clearly a successful one. So I'm very happy about that. And for me, as I had mentioned before, coming into this entire process, I recognized that I needed to work with someone who was able to provide me with a pathway, describing or really laying out the application process and what that looks like, and utilizing the information provided from the fellowship, from the hospital itself, see what is it that they are looking for. And how do you in turn look at your own experiences, your own training, your skills, and see how best you can highlight it and show that you would be a good fit for the program. And that is something I personally struggled with, because is one thing to just write a list of skills or tasks I'm able to perform well. It's
Right.
another thing to really position yourself and say, hey, you know, I am the best person for the job.
Right.
See here my experience.
See the reasons.
And the reasons why you would like to choose me. You know, that was really difficult for me. So throughout the entire process, I was able to see how one component of my application bundle really tied into another one. And therefore, it was like you could see the connectivity between all the components of my application. And it really reflected me, my experiences, and it showed how I would be of value to the program. And I can definitely say without utilizing memorable essay, I wouldn't have been able to do so, because I'm very much somebody I would just write down, okay, this is what I can do, but that doesn't really say what I can really add to a program. Because I mean, everybody is well trained. Most people who are applying to fellowships or even medical school or, you know, residencies, most people are well trained. You know, they're knowledgeable, they have degrees. So what sets you apart? Right. And in working with you, and I was able to see how I could utilize the stories, the experiences I've had to really show, you know, what I'm thinking, what kind of values I have. Do they match with the values of the program that I'm looking to apply to? Is my experience or my skills something that they can utilize? And it was very well thought out. It was organized. I was able to go through step by step and say, okay, how do I organize my thoughts? How do I get them on paper? And then with your help, you're able to say, okay, well, by asking specific questions, it really drew out the information that would have been useful during the application process. Right. So for me personally, I had assistance with, you know, personal statement of purpose, you know, revamping my CV. And again, you could see the connectivity between the personal statement of purpose, the CV. It all tied in. So it didn't seem just disjointed. Right. And then utilizing all of that, I was then able to prep for the interview. And I think having that practice where you said, okay, you asked me some questions and I'm able to say, okay, well, this is what would come off at the top of your head. But you realize, you can't really approach it like this. Again, look back at what you've written before, you know, tie in what you've presented to them in your interview, and use it to really showcase yourself and who you are as a person. And for me, the entire process went smoothly. I really appreciated that there were deadlines. And, you know, if we had, there was no, I need deadlines. I am someone, I'm not gonna lie, I'm someone who will procrastinate. But if it's like, no, it needs to be done at this date, I will make sure I sit down and I do it. So that helped as well. And just being able to, you know, reach out and say, you know, I'm not really sure how to answer this question, or I'm not really sure how to approach this part of the application process. And you were easily accessible, always ready to help. So I really appreciated that. And just even during the interview, just being able to say, okay, interview, we did our little practice. Okay, this is what, you know, I'm concerned about how you phrase this. How about, you know, here's another way of looking at it, another way to present yourself. And again, go back and look at the program that you're applying to, really research, know the people who will be interviewing you, who's on the panel, and be able to really connect. So advice like that, I think, really made the difference for me and in my application process, because it has been said to me quite a few times since applying that, you know, they really loved my application, you know, like my personal statement and statement of purpose. And, you know, they would often refer to things I've said in those different components of my application. Right. And, you know, to point out, you know, I realized that you really seemed interested in X, Y, and Z. And, you know, here's an opportunity for you to actually gain further training in that. And that wasn't even the main purpose of the fellowship. Right. Really because of how my application was presented to them, it clearly made a significant impact, which is
Right.
what I was going for. But I think it even surprised me. Like it was, yeah, I want an impact, but I was just like, oh, okay. this really seems to be working. Okay, cool. And so I would recommend it to anyone, hands down. Again, I said it before, it was really an investment in myself, because I know sometimes people tend to be like, I ain't trying to spend money, you know, but it's like, you know.
Do you take hugs?
Honestly, I always say, you know, you can't, you're utilizing the expertise of someone who's done it before, done it for other people, who, you know, been in this business for a while and who has significant insight. And that is valuable, you know. And so if I'm going to access that expertise and that insight, I got to shell out coins for it, because if I want high quality, it is what it is, you know. I have to invest in myself, and I have to see the whole process and utilizing this service as an investment. And it has paid off for me already. I'm not yet there, but I have been accepted to the program. And that was simply because they were so impressed with my application. So even though initially there were some stumbling blocks along the way with getting into the program initially, you know, I was kept in mind, and the effort was made to see how can we get you here. So there were some difficulties in the beginning, or rather some stumbling blocks, meaning that they were very impressed with my application, but initially I didn't get accepted to the fellowship because of simply how they are expected to choose the fellows based on UK labor laws. But because they were so impressed with what I had to offer, you know, on my application itself and how I performed in the interview, that they actually made a point to stay in contact with me and make an effort to see how could I still come to UCLH? How could I be involved? How could I, you know, be a part of their fellowship? And I mean, this was even suggesting other fellowships that I could even join if I was interested, simply because they were so impressed with the quality of my application. And, you know, I am very much aware that the application that I had presented to them would not have been of that quality if I had not utilized memorable essay. So hands down, it has been one of the best investments I've made in this entire process. And, you know, I would be willing to recommend memorable essay to any and everybody as far as I'm concerned, because often we as medical people, you're so tight, your skills and your experience are so tied up in the whole process of just being a doctor, that having to go through this entire process can leave you feeling very lost, a little overwhelmed. They're not really sure, you know, what is the best way to go about it. And so I was really thankful for the guidance and the push to really learn how to showcase myself and what I could do and what I had to offer. So I'm really, really happy about that.
Thank you, Asherah. And then, of course, Asherah, you're like the dream. You know, I guess it's probably like with you as well. There's some, you don't call them clients, patients who you can help. And there's some who it's just like, you know, no matter how much you try, if someone wants to do whatever, you know, you can't. But just definitely thank you, first of all, for trusting me, or you even like bring up deadlines. You know, people are just different. There are people who deadlines mean nothing to them. What you recommend means nothing to them. But definitely you had a lot to work with, which is why I do this, just like knowing that there are people like you who you're so brilliant and you bring so much to the table. But then if you ask you to say it, Asherah sends you a CV with like a list and you're just like, but, you know, there's so much more going on here. We need context to show the people why you have so much value. What? So it's like, you know, honestly, it's definitely like a dream in that sense to be like, oh, look, there's all of this going on. And then I get to put it together to make everybody understand, you know. So that was really great. And I'm actually personally and selfishly looking forward to seeing the work you're able to do, because obviously, I mean, you've detected the need. So it's definitely needed in the region. And it kind of gives me like this sense of assurance that I know there'll be somebody kind and sensible out there trying to make sure that grandma and grandpa come home and it's not like away with them.
Yes, for sure. Yeah. So this process, I fully enjoyed it. I mean, it happened around a difficult time as well, for me. So to have somebody who's still willing to work, and I know the deadlines were like really close,
right,
and we were still able to, work together to produce something that really left a significant impact on the head of a program, out there, who's now like, no, we need to figure out how we're gonna get you with us. And I was just like, oh, okay, sure.
No problem.
So,
take your time.
Sure. I'm glad, but definitely it is no joke. They keep referencing, from your application, we realize that, you're really interested in X, Y, and Z, or you have some experience in this, and you can always have the opportunity with us to, further train in that particular area. And that really, showed me that when they went over my application, clearly there was quite a bit that stuck with them.
Right.
And made them want to know more about me and work with me. And that is really what you as a candidate want. You want people to see the value that you have and what you have to offer, and want you to be working with them. So I'm really grateful for that experience.
See, now you could run memorable essay. You get it, yeah? That's exactly it. You want people to see what they'll get from you,
Yes.
And what they can't get from anybody else. All right, so my final question in closing is for the young medical student who wants to be a surgeon. Why should they not be? I'm kidding. No, but for the medical student who's coming up and they probably have their eye on anesthesiology or on becoming an anesthesiologist, what advice would you give them? Maybe something you would have done different in medical school, or maybe not that, but how would you point them in which direction to look to? Like, where is the future of anesthesiology? I don't know. Like, what would you say to anyone who's looking to follow in your footsteps?
Well, I would say for anyone who's contemplating anesthesia to, one, do not underestimate your impact. As I mentioned, in anesthesia in particular, oftentimes for most patients, you see them once, you anesthetize them, you say goodbye. There's no continuity as you would get as if you're a surgeon for a lot of patients. But yet you still have a significant impact to be made. And you are dealing with patients who are often frightened and, scared. So it's not just knowing the clinical side of it. You have to be very much aware that you are the person who can, reassure a patient and really bring them some comfort and some understanding. And as a clinician at the base of it, and more I realize this during training, that to have some time to sit and really talk with a patient, because a lot of times patients do not get all the facts necessarily communicated to them, and they're scared and they just want to do the right thing.
Right.
But you have an opportunity to really say, do you really understand what's going on? Is there anything you really want to ask me? Is there anything else you're not sure about? Do you want me to call the surgeon again so you're not confused about anything? And you will realize just in showing compassion at that level, you can often make the greatest impacts. The patient doesn't have one clue what you're doing while they're asleep.
Right.
They're not worried about that part. They want to know, they want to feel assured that you care about them and you genuinely care about them and their outcome and how they're going to do. And I find if you as a doctor maintain that focus, you would always be a good clinician, because you would always have the drive in turn to say, in order for me to offer this patient the best care, I need to know as much as I can know. I need to enhance and build my skills as much as I can. You won't be satisfied with barely doing the least, just to say, well, I'm a doctor. That's it. Right. And So it's actually something I often tell my juniors as well. You know, you have to have the drive to realize it's not about the title, it's not about saying, oh, well, I can do X, Y, and Z. Is at the end of the day, if you care truly for your patients and how your patients are going to do and how they feel about the entire process, you will do your best. So, you know, pour yourself into getting practice, you know, improving yourself, your knowledge, your skills. And once you keep the genuine care for the patient at the core of it, you will always do well. And anesthesia is very knowledge heavy. You're expected to know a lot about a lot. And but you can't have it in your head that just because I know something that makes me a good clinician.
Right.
At the end of the day, you know, I'm the person who has to tell them, no, it's okay, you'll be fine, don't worry about it, think about something nice, you're gonna go off to sleep. It's, you know, so it's actual patient interaction and the humanness of it. So I find a lot of young doctors, you know, you feel nice because they're calling you doctor now, you know. Well, but if you don't have a genuine care for people, it shows, and it actually shows in the type of care you deliver to those patients. So, I mean, that's not a very, oh, you know, do this, read this, da da da. But to me, that's the most important thing. So care about the patients, want the best for them, and in turn, improve yourself so that you can do the best for them. So that would be my advice to anybody. Really.
Well, thank you. I mean, you know, because you're out there every day with them, so you would know what they should know or what you feel like will make the bigger difference. All right. So thank you so much, Asherah, for taking your time to chat with us about your experience, and of course, wishing you all the best in your fellowship.
Thank you.
Thanking you for improving yourself, because I know that, I mean, this is not to knock anybody who doesn't have the chance to or doesn't want to, but obviously the better that you get is the better the quality of care that you'll be able to provide to people. And so I actually just want to thank you for doing that as well, because it will make a difference out here. So thank you.
Thank you. Thanks for having me.
All right. Okay.
No problem. No problem.
All right, then. Take care.
All right. Bye-bye.